Go ahead and make a fist right now. Squeeze it as tight as you possibly can. Hold it, because what you just did with your hand may actually reveal more about the condition of your heart than a standard blood pressure reading ever could. Over the next 5 minutes, I'm going to walk you through 7 specific things your hands can tell you about what's happening deep inside your cardiovascular system. And some of these are going to genuinely surprise you. Here's the part most people don't realize. Somewhere between 45 and 50% of all heart attacks happen completely silently. No warning, no dramatic chest clutching moment, nothing. You can have perfectly normal cholesterol levels, managed blood pressure, zero chest discomfort, and still be heading toward a cardiac event without a single obvious clue. That's exactly why these subtle, often overlooked signals matter so much. Number 1. The grip test. Let's start with that fist you just made. There's actually hard science behind why I asked you to do that. Back in 2015, a landmark study published in The Lancet examined data from tens of thousands of people across multiple countries. What researchers discovered was striking. For every 5 kilograms, that's roughly 11 pounds, of grip strength a person loses over time, their risk of dying from a heart attack climbs by 17%. And this wasn't an isolated finding. The result was replicated across multiple independent studies, making the correlation remarkably consistent. Here's what makes this even more remarkable. Grip strength turned out to be a better predictor of who would die from heart disease than blood pressure. Let that sink in. Blood pressure is one of the most routinely measured vital signs in medicine, and yet something as simple as how hard you can squeeze outperforms it in forecasting cardiac mortality. When was the last time a doctor squeezed your hand and timed it? Probably never, because the medical system stays locked on blood pressure cuffs. But why does grip strength connect to the heart in the first place? Your muscles, including the ones in your hands and forearms, are deeply tied to your cardiovascular health. Muscle mass, oxygen delivery, mitochondrial efficiency, and vascular function all play into how strongly you can grip. When these systems start to break down quietly, the hands are often one of the first places to show it. If you have an actual grip strength tester at home, here are the numbers to aim for. Men should stay above 81 pounds, or about 37 kilograms. Women should target at least 51 pounds, or 24 kilograms. No device? No problem. Ask yourself honestly, do you find yourself handing jars to other people to open? When you shake someone's hand, does your grip
Feel genuinely firm? Or does it feel like something you're just going through the motions of? These aren't trivial observations. They're real-world signals worth paying attention to. Number 2. The ring finger lift test. Place your hand flat on a table, palm down, and try to lift just your ring finger straight up off the surface. Now, notice what happens in your palm.
Does the skin there feel tight, almost rope-like, like there's something pulling from underneath? If so, that's not just a quirky hand thing. It's potentially your palm sending up a quiet distress signal about something happening systemically. Researchers conducted a review spanning more than 32 separate studies and found that people who experience this kind of tension or contracture in the palm are nearly 3 times more likely to have diabetes and almost equally as likely to be dealing with serious liver disease. A 23-year longitudinal study following over 30,000 people added further weight to these findings. Here's the biological mechanism. When blood sugar stays elevated for extended periods, excess glucose begins bonding to proteins throughout the body in a process called glycation. These sugar-damaged proteins don't function properly. Over time, this same process damages blood vessels, stiffens arterial walls, and creates inflammatory conditions that directly correlate with cardiovascular deterioration. So if your ring finger doesn't lie completely flat, if there's tightness or pulling, that's your cue to get your blood sugar checked. And while you're at it, talk to your doctor about your heart. Quick thought before we continue. Your body runs on about 10 key biological signals. Things like insulin, cortisol, inflammation levels, sleep quality, and gut function. Each of them influences how you feel and how your organs perform. But there's usually one signal that's more disrupted than all the others. And until you address that specific one, the rest stays stuck. There's a free 2-minute quiz linked in the description that helps pinpoint which signal is holding your body back right now. Stop guessing. Click the link and find out. Number 3. Clubbed nails. On a normal finger, the nail meets the skin at a distinct, visible angle. You can see that angle clearly if you look at the side profile of your fingertip. But when something called nail clubbing develops, that angle disappears. The tip of the finger rounds out and bulges, almost like the end of a drumstick or a small balloon inflating under the skin. This happens because of something unusual circulating in the bloodstream. Certain compounds that would normally get filtered out as blood passes through the lungs slip through instead, and they eventually end up affecting the tiny capillaries at the very tips of your fingers, the most peripheral point your blood reaches. The result is that gradual swelling and rounding of the fingertips. About 75% of clubbing cases trace back to the lungs, things like chronic lung disease or long-term low oxygen levels. But 10 to 15% of cases are directly linked to the heart itself, particularly congenital heart conditions or those that impair circulation significantly. Since lung and heart health are so interconnected, even lung-related clubbing can serve as an indirect cardiac warning. If you've noticed your fingertips starting to change shape, especially within the past 6 months, don't wait on that. Get it checked. Number 4. White or cloudy nail beds. In a healthy person, your nail beds have a natural pinkish hue. That color comes from good blood flow, oxygenated blood flowing through tiny capillaries just beneath the surface of the nail. When the heart isn't functioning efficiently, that blood flow becomes sluggish or reduced. And one of the earliest, quietest places this shows up? Your nails. They turn pale, whitish, or take on a slightly cloudy, washed-out appearance. This actually reminds me of a patient. I'll call him Robert. He was 54, a construction worker his entire adult life, and he came to see me specifically for a finger contracture problem. He thought I might be able to manipulate the joint or do some kind of hands-on correction. He wasn't worried about his heart at all. But when I looked at his nails, something caught my attention immediately. They weren't clubbed, but they were noticeably pale and cloudy. I went through his medical history and learned he'd been eating a diet heavy in refined carbohydrates and sugar for years. I asked about his A1C, the blood sugar marker, and it was elevated. Not fully diabetic, but solidly in the pre-diabetic range, moving in the wrong direction. Something about the whole picture made me uncomfortable enough to refer him to a physician rather than just working on his hand. His doctor and I stayed in communication throughout the process. I worked with Robert on his nutrition, his sleep habits, and his exercise routine. Over time, his EKG improved, and his cardiac tests came back much better. The contracture itself, it never resolved. The scar tissue was too established. But that was fine, because we'd caught something far more important in time. If I just focused on the finger and ignored everything else those nails were hinting at, the outcome could have been very different. Number 5. Yellow bumps on the tendons of the hand. Turn the back of your hand toward you and extend your fingers. You'll see thin cords running from your knuckles toward your wrist. Those are your extensor tendons. Now, look closely at those cords. Do you see any small, firm, slightly yellowish bumps sitting directly on the tendons? If you do, that's worth taking very seriously. These bumps, called xanthomas, form when cholesterol deposits build up directly on tendon tissue. They tend to appear in people with a genetic predisposition to elevated cholesterol, particularly familial hypercholesterolemia. A study examining over 950 individuals found that the presence of these tendon xanthomas correlated with a 36.7% increase in the rate of heart attacks. And for women over 51, that risk doesn't just go up, it jumps 17 times higher than the baseline. That's not a typo, 17 times. If you spot these bumps, a basic cholesterol panel isn't enough. Ask for an advanced lipid profile that measures particle size, specifically the ratio of small, dense LDL particles. It's those small, dense particles that are the real problem. They're small enough to penetrate arterial walls and cause damage, while large, fluffy LDL particles tend to be much less dangerous. Knowing your total cholesterol number without knowing particle size is like knowing the weather without knowing which direction the wind is blowing. Number 6. Fine tremors. This one requires a bit of careful observation. Hold both hands out in front of you, palms down, fingers slightly spread. Don't focus on big, obvious shaking. Instead, watch for something very subtle, a tiny, rapid, almost electrical quiver happening simultaneously in both hands. This is different from the coarser tremor you might associate with something like Parkinson's disease. What we're looking for here is a fine, high-frequency tremor, like a barely visible vibration that runs through both hands at once. Approximately 75% of people with an overactive thyroid, a condition called hyperthyroidism, exhibit this type of tremor. And here's the key detail that helps differentiate it. A thyroid-related tremor almost always comes packaged with hands that are both warm and slightly damp at the same time. That combination, fine tremor, warmth, and moisture, is a pretty specific constellation pointing toward the thyroid. Why does this matter for the heart? Because an overactive thyroid can push the heart into dangerous overdrive. It can cause rapid or irregular heart rhythms, raise blood pressure, and put chronic, unsustainable demands on cardiac muscle. Left unchecked, hyperthyroidism can seriously damage the heart over time. If you're noticing tremors in both hands, just get your thyroid levels checked. It's a straightforward blood test, and the information it gives you could matter enormously. Number 7. Cold hands. You've probably heard the old saying, cold hands, warm heart. But medically speaking, cold hands do carry some meaning worth understanding properly. The common assumption is that cold hands mean poor circulation, and sometimes that's partially true, but the fuller picture is more nuanced. Cold hands are often driven not by the heart directly, but by the autonomic nervous system, specifically the branch responsible for your stress response, the fight or flight system. This system controls blood vessel constriction, and when it's chronically activated, it pulls blood away from the extremities and redirects it toward your core and major muscles. Here's the distinction that matters most. If your hands are cold all the time, regardless of what's happening around you, no stress, no anxiety, just perpetually cold, that's more likely a circulation or thyroid issue than a direct cardiac one. But if your hands specifically go cold in response to stress, they're fine at rest but turn icy the moment you're anxious, pressured, or overwhelmed, then that's your autonomic nervous system signaling that it's chronically dysregulated. And chronic autonomic dysregulation has very real downstream consequences for heart health. Cold hands triggered by stress deserve a deeper look. What to actually do from here? If any of these 7 signs resonated with you, if something made you pause and think, wait, that sounds familiar, here's a practical roadmap for the tests that matter most. Grip strength. Test it at home or ask your doctor. Keep it above the benchmarks we mentioned. Resting heart rate. Check it first thing in the morning before you get out of bed. You want it below 75 beats per minute. If it's hovering around 80, 90, or higher at rest consistently, that warrants medical attention. A1C. This single blood test gives you a 3-month average of your blood sugar levels and is one of the most informative windows into your cardiovascular risk. Prediabetes and diabetes are both deeply linked to heart disease progression. Fasting insulin. This one is underutilized but incredibly telling. High fasting insulin is one of the earliest indicators of insulin resistance, and insulin resistance drives systemic inflammation, including in the arteries. There's no perfect consensus on the exact ideal number, but lower is definitively better. Thyroid panel. Hyperthyroidism in particular can wreak havoc on cardiac rhythm and function. A simple blood test can rule it out or catch it early. CAC scan, coronary artery calcium test. If you want to see what's actually happening inside your coronary arteries, this is one of the most direct tools available. It measures calcium deposits in arterial walls, which is a marker of established plaque. It's low radiation, relatively inexpensive, and gives you a concrete number rather than a probability estimate. Your hands are telling a story every single day. Most of us just haven't learned the language yet. These aren't perfect diagnostic tools. Nothing replaces working with a qualified physician. but they are legitimate, research-backed signals that can prompt you to ask better questions, run smarter tests, and act before something becomes an emergency. The most powerful thing you can do next is understand how to support your cardiovascular system through what you eat. For that, make sure you watch the next video. The link is right here.